Welcome to the bright side of aging. My name is Ike Engelbaum. I'm a pharmacist and publisher of the AmericanSeniorGazette.org, and I host a daily radio show titled Bright Side of Aging. It has been wisely said that you cannot help getting older, but you can help getting old. Also, age is a matter of the mind. If you don't mind, it doesn't matter. My purpose in doing this program is to provide seniors and caregivers a forum to share their ideas on how we can age gracefully and in a vertical position for as long as our good genes will allow. And if we've inherited bad genes, how to outwit them. And I'm really excited about having Dr. Joel Kahn with me, who is aging gracefully, I might say.
That's kind of you. Thank you.
You are aging, right? Just like the rest of us?
And I don't mind. Just like you said.
No, right. And we shared before I got on the air that you actually get up at 4:30 in the morning to do exercises?
Not every day.
Not every day.
Because sleep is critically important to not aging in a ill way.
In a negative way.
Once a week, I burn the candle really bad and get up at 4:30. The other day is more like 5:45. Wow. Today was my 4:30 day.
Wow. Well, you know, I have been told how important it is. Is it the cybernetic, what is it, the circadian rhythm that we have?
Circadian rhythm, that's right.
Circadian rhythm.
We were destined to go to sleep at dusk and wake up at dawn, and we've chosen through technology and industry and all that's happened in the last 150 years to be masters of our time. We can sleep 3 hours, 4 hours. We're learning that is a shortcut that we will pay a price for, even 1 night, 2 nights. It's very important to focus in a general way and an anti-aging way to try and get 7 to 8 hours sleep at night, and that is what I do most nights.
Now, I know you're not necessarily specializing in sleep disorders and all, but I thought I would try to get your opinion in regards to the whole aspect of sleeping. So let's say you don't sleep that well. Is it of any benefit just to be there in bed for six to seven, or should you get up? What is your thought?
You really do want to be out. You want to be asleep. And there's a whole, half of America answers to a survey. Either they sleep poorly or they choose to cut their sleep back because their schedule is so crazy. And it is a factor in why America is overweight. It's not the only factor, but it is a factor. People that sleep short amounts hold on to weight and have a very difficult time losing weight. And ultimately, the reason I'm very interested, in fact, my next major book is on sleep in the heart. It has a very bad effect on heart health and certainly can lead to brain problems like greater risk of Alzheimer's. So in my world, actually, we've got nutrition and fitness and joy and connectivity and employment that you're enjoying it all. But sleep is really the foundation. You're not going to work out, you're not going to eat well if you're dragging around exhausted all day. So it's kind of a new emphasis in medicine in general, now that you ask.
Yeah, from a practical standpoint, if you can't sleep and you're awake that much longer, you have more chance to eat.
Well, there's no doubt the 3 a.m. refrigerator rate is more likely, which is not only unnecessary because we are eating too many calories on average a day, but it really messes up. Part of the magic of sleep is you're resting your GI tract. It's kind of a cleanup process every night to kind of move stuff through and start the day again. Not just your GI tract, that happens in every part of your body, but you're right. If you're out of bed at 2 in the morning eating Ritz crackers and Oreos, there's a whole cycle that you've interrupted. That never was part of human culture until recently. So dark rooms, cold rooms, getting that TV, getting the computer off 45 minutes before bed. One of the magics that nobody does is an Epsom salt bath, full of magnesium salts, warm water. Great way to ease into bed, if you've got the time to soak for 20 minutes. And really quiet. I have pets at home that sleep on my bed, and I love them dearly. Not a great strategy for a good night's sleep. You can go through a list without even getting to vitamins, supplements, and my least favorite drug, prescription drugs for sleep. Not a good idea.
Now, just to clarify, you're not one of these naturopathic, necessarily, I hate to use the word nuts, health nuts, that does not believe in conventional medical. You are a cardiologist. In fact,
Right.
what is your official title again?
Well, I have many. I'm a professor of medicine at Wayne State University School of Medicine. I'm a professor at Oakland University Beaumont School of Medicine. I'm a professor at University of South Florida School of Medicine. So I actually got 3 academic titles. I teach a lot. And I'm not anti-medicine. I prescribe medicine in my office every day this morning. However, in the elderly, there's a concern that drugs like Xanax and Valium and sleep prescription drugs actually slightly increase your risk of dying earlier than your time. That's the medical science. So I work very hard with my patients to come up with other ways to get their sleep enhanced. As kind of Eastern as it sounds, there's now a big resurgence of meditating for 10 minutes before bed, simple things that you can do at home, and the improvement in sleep has been scientifically shown in the last few years. So there's no side effect to meditation, and none of us really grew up with it and are necessarily naturally comfortable with it, but it's one of the pathways to a more joyful life and a better life. So I try and introduce, I have a big toolbox. I use prescriptions, I use surgery, I use nutrition, and when necessary, I'll use a whole lot of other things like vitamins and some of these practices like meditation and yoga.
Now, frankly, as a pharmacist, meditation was not exactly part of our curriculum, and I'm sure in medical school, was that strongly taught as well, or?
Sure, take 2 ohms and call me in the morning. It's absolutely right. No, not at all. In fact, I'm not aware of a medical school in America that probably is teaching the science of yoga or meditation, although there is very strong science. In my field of heart disease, if you've had a heart attack and learned to meditate and do everything else right, or you just do everything right without ever being taught meditation, the group that gets taught meditation has a 50% drop over 5 years of going back to the hospital, having another heart attack, having another operation. That's a very large published study. It never went anywhere in medicine because there's no system to teach it. There's no reimbursement to encourage it. So it was a really novel study done in a University of Iowa. Just an example, pretty recent study. So there's no medical school that embraces this whole philosophy. And that's why I go out there and I talk and I teach and I write and I do shows like this, because I only speak about what the science can support, but there's some really funky stuff in the science that encourages us to keep an open mind.
Now, how are you looked upon by your quote-unquote conventional medical colleagues?
They call me Dr. Joel Buddha. I'm very conventional in much of what I do. I make hospital rounds, emergency rooms. I mean, we're not getting too funky when we're dealing with people in the intensive care unit. I was in the cath lab this morning doing procedures. You know, we're right on track. But when you're talking about the long-term lifestyle management of a patient, the simplest thing is to renew the prescriptions or add prescriptions, and I do that. But many people are interested in the alternative. Is it possible I could be on 3 drugs, not 5? Is it possible the side effect I'm having from this might be eliminated if I do something or learn something new? And I try and move them towards learning or practicing something new, whether it's better nutrition, better fitness, better sleep. And the results are pretty strong. I'm very, very, very encouraged.
Now, as far as your quote-unquote average patient that walks in, he's a medicine, and you start the Dr. Joel Kahn approach.
Right.
How do you start weaning off, for lack of a better term? You say, hey, you know, this person is taking quite a few medications. Is there some sort of a bridge that suddenly that you try to show that individual, hey, maybe we start with nutritional type approaches? Is there a procedure?
Well, I always like to start, I don't think people buy in to, 1, they have a little education, and 2, then they've got to decide if they've got it in them. There are people that know they're doing the wrong thing, they'll keep doing the wrong thing. It doesn't matter how much you educate them. So it's kind of both. But I certainly like first to open the door, and I literally take out my prescription pad and I give patients homework. So on the next visit, I'll ask you, did you watch this DVD, Netflix movie that describes the health benefits of changing your diet and exercise. Would you go to this website and consider for 3 weeks what is suggested here and eating different for heart patients? Would you delve into an article I wrote or somebody else wrote? And on follow-up, I'll ask them, and very often they're interested enough to do that. There's no judgment, often there's no expense, and they've taken the first step. Then you get to the harder issue, which is changing habits. And we know in every field of medicine and life, people are very resistant to changing habits. So I'm patient with people, but that's when we get to the hardcore. Let me give you a few more steps and a few more tips. And do all patients exhibit an interest? Absolutely not. It's a little frustrating. There's a very well-known theory on when people are ready for change, and some people stay in their first bucket, and they know that the smoking and the diet and the weight problem is harming their health and probably shortening their life. They're not going to move to the next bucket. You can only be patient and keep bringing it up. But man, those that are ready to run, let's run. And we can, monitor their blood sugar, their blood pressure, their cholesterol as we begin to improve some aspect of the lifestyle using nutrition. Eat more vegetables, eat more fruit, eat less junk. I just told you everything you need to know about cardiology and, in a nutshell. But putting it into practice means you got to grocery shop different, you have to fill your refrigerator different, learn some new recipes, be a little bit more diligent in restaurants, and and practice and make some mistakes. But in the long run, people are very encouraged. Most people don't realize there's the possibility, not promise, that diabetic medicine, blood pressure medicine, cholesterol medicine could be reduced if they just learn some new skills and practice them daily. So it's a matter of finding those that are ready, and we've had quite a success.
Now, in your personal life, you literally practice what you preach. Is that correct?
I do, and it's not hard. There's about 6 steps you need to do to try and create a lifestyle that you never have a heart attack. This is science. You don't smoke, so that's an easy one. I don't smoke. Number 2, you try and get 7 hours sleep a night. That's part of the science, and I try and do that much more than previous parts of my career. I can't control if the phone rings in the middle of the night, but I do get in bed geared for 7 hours of sleep 6 nights a week. 1 night a week, I get up a little early to chase the gym thing. I work out other days. I just work out for less. Number 3, you got to keep your weight under control. You got to keep a man's waist under 40 inches, a woman's under 35 inches. Not a really difficult goal, but in this country, getting harder and harder, and I've achieved that. Over here is kind of a fun one. You're supposed to actually have an occasional alcoholic beverage during the week. That's been associated with a reduced risk of heart attack. So you got to be very careful with that one, that you don't overdo it, and it's not appropriate for people with certain medical problems. The last one and the final one is eat fruits and vegetables, eat fruits and vegetables. The science says more than 5 servings a day. So I'm summa cum laude in the fruit and vegetable department. That's all I eat. I've been a long-standing vegetarian. But for anybody listening, just eat an apple. Just put lettuce on a sandwich. Just put a carrot stick and a celery stick next to your sandwich. Put some beans in your soup. Eat fruits and vegetables. You will reduce your chance of heart attack, stroke, diabetes, weight problems, dementia, cancer.
I hate to break on this bad suggestion you just made.
Very controversial.
No, you just said eating an apple a day. Doesn't that keep the doctor away? Oh, is that bad or bad? But it will come back, and you're going to have a chance to defend yourself and also talk a little bit about your various ventures, and there are many of them.
Thank you.
We'll be right back.
Hey y'all, come on down to Friendship Park for Barn Days on September 12th from 11 a.m. to 5 p.m. We got pony rides, a pet and farm, games, inflatables, and so much more. Plus the food is just amazing. Maybe enjoy a hayride with the family. But watch out, there's some people around here that don't know the Civil War is over. The cost is just $5 per car, so don't miss Barn Days, September 12th, 11 a.m. to 5 p.m. at Friendship Park. If y'all want more information, call 248-391-0304, extension 305, or check out orienttownship.org.
And we're back with Dr. Joel Kahn, a medical doctor, and your official title is, as far as specialty?
Well, I'm a cardiologist and a preventive cardiologist. I hope nobody ever needs to see me because they listen today and they do everything we talk about.
Well, it'd be terrible for the whole medical field, but that's okay. You can handle it. You were a prolific writer. I just have this one book here that Dead Execs don't get bonuses. The ultimate guide to surviving your career with a healthy heart. Wow.
Yep.
And you have your own webpage, being a prolific writer. What is it, Dr. Joel Kahn? What is your website?
Yeah, it's 10 letters, drjoelkahn.com, but drjoelkahn.com.
I see. All right. Well, great. So now this is your second or third book, is it?
It's second book. Number 3's done, and number 4 is starting. I enjoy writing.
When the heck you're sleeping 7 hours?
I have my wire geared to my typewriter, and as I'm dreaming, it just comes out.
Is there a progression of your writing these books? I mean, you started off, let's say, since we're a sports town, let's say you're at base, you start with first base. What was the first thought that you said, hey, I'm going to write a book and it's going to be on?
Yeah, I had finished just about 3 years ago, although I graduated medical school a long time ago in Ann Arbor, I went back to school about 4 years ago and got another degree in preventive cardiology at University of South Florida. And I learned so much, I said, I want to tell everybody. And I thought writing a book would be a good idea. So my first book, called The Whole Heart Solution, which has been out less than a year, goes over 75 tips that are practical and easy, science-based, that could make your heart health much better, whether you have heart disease or you never want to have heart disease. As simple as, we've talked about a lot of them, nutrition, fitness, what might be called mind-body, stress management, sleep management. So it goes through a whole gamut, and it's written for patients. I'm proud of the book, but it's not a lot of heavy terms that you have to look up. I mean, you'll understand it.
Mm-hmm. So I would imagine, and that's my kind of writing, is that 75 steps, we got 10 commandments, right?
Right.
There's a specific number. So this may be too open-ended a question, but obviously you can't start all 75 at the same time. Is there a sequential order that would be practical? Let's say start with 6 to go on.
Yes, it's kind of structured. Starts with the nutrition. Pick up some habits on nutrition. For example, maybe you're not ready to eat 10 servings of fruits and vegetables a day. The science of spices. Is it possible to put cinnamon and nutmeg on your oatmeal? Is it possible to put Italian herb seasoning and curry powder on your soup, salads, and main course? The science behind simple steps like that for what they do for your health, your blood pressure, your cholesterol, even your arthritis pain, tremendous.
Now, you actually can be not only called a doctor, but you're also an entrepreneur. And
I can't spell it, but I am one. That's right.
Well, good news with spell check now, right. You're home free. So rather than just writing about it and talking about it, you're going to actually open up a restaurant, I understand, in Ferndale, is it?
Right at 9 in Woodward. In about 4 weeks, I just came from there. We're opening a large, when I say we, joyfully, my 30-year-old son and I, so it's a family project. My wife's very involved. His wife's very involved. So it's a large health restaurant on 9 Mile called Green Space Cafe. It wasn't a health restaurant before. It was a couple other businesses, so we just ripped everything apart and now seats about 130 people. There's a full liquor license because I said on the first segment, a little bit of vino is on the list for life and longevity enhancement. And the food's going to be amazing, yeah, and that'll open about October 1.
I see. Well, listen, actually a practical approach. You can at least literally get a taste of what you could do at home. Is that correct?
Right, and it's not a medical clinic. It's we say it's an amazing restaurant that happens to be healthy. That's not the feeling you'll have as joyful. But I'm going to do some really interesting courses and food demos, and I'm going to have heart clinics there in terms of education. Yeah, I'm not going to see patients there, of course.
So what about now, this is the most recent book, Dead Execs Don't Get Bonuses.
That's right.
How is that different from your first book?
Yeah, this is a very focused book. Right now this week, it's been in the news all over the world. Too many hours a week is related to increased risk of stroke and heart attack. That was the news a couple days ago. Today the news came out that if you're stressed at work, it's the same risk to your health as smoking. And that was the news today. I did a radio interview this morning out of Denver about that. And we know that. We know that work can be a joy, but it can also drag your health down. It can probably shorten your lifespan. You may be dying at work by all the stress and the food. So this book says, how do you know it's not affecting your heart? What's the best test to get? What's the best lab test to ask your doctor for? What's the best program you can do to survive your career by eating healthy, learning to do a little exercise at work, learning to deal with stress? That was the kind of the news of today, is how dangerous stress can be at work. And for most of us who have a work career, we know there's many stressful moments. So all that is packaged here to read in about an hour and a half and say, okay, maybe I need to do a few things to find out. And that's what my practice is. My practice is mainly my cardiology practice. Checking people out there, walk in the door and say, I think I'm okay, but you tell me I need a checkup. And 10 days later, we've got a whole package of information. And sometimes they're perfect, and sometimes we've got a problem.
Right, right. Tell me, what are your thoughts? I had an interesting discussion with a friend of mine who works for a big corporation, and he said, we got this new CEO. For years, apparently, that company had a policy that every 90 days, within 90 days, every one of the employees was to take a week's vacation. And it was never really stressed, you should excuse the expression. This new guy says, you got to take it. Do you feel vacation, taking a week, is as important, let's say, with 7 hours of sleep, or is it just company policy to keep the books clean?
Yeah, it's pretty clear that days away from work can be renewing and make you better as a whole person, so you go back to your job with more enthusiasm. Of course, it's like taking a bath. You're going to have to do it again the next day, come back from a week vacation, and many of us come back to phone calls and emails, and it takes 2 weeks to overcome 1 week away. So there's a balance there. I think more important is trying to figure out the other 48 weeks a year that you're not on vacation. How can you work in a good diet? Can you bring your own food? Can you bring your own snacks? Can you sit and move and stand frequently so you're not locked in a cubicle? And really, again, can you find some way to deal with stress? Maybe it's coming to work after a workout. Maybe it's learning to do some simple breathing at the desk, but some humor and joy. You really got to get through work without an ulcer at the end of the day, because it's going to shorten your lifespan. And that's what we talk about.
I'll never forget, we had a speaker at one of our pharmacy conventions who was around 350 pounds, and he made the comment before he started, here are a group of pharmacists, and here's this overweight guy, and he was promoting a diet, new prescription diet pill was just coming out. He says, you guys are probably wondering why they pick a guy my size to give a talk about dieting. Well, I want you to know I did lose about 50 pounds. I found a real good way of doing it. They say hearty laughing, ha, 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 ha. Really out of the stomach part, whole anatomy, is almost as good as 30 minutes on an exercise bike. So I rushed out, got an exercise bike. Now every night when I come home, I take the exercise bike out, and I sit down and I start laughing at it. That's not a good way, right?
Not a good way.
Not a good way. Okay, right. Well, tell me a good way. How much exercise time do you spend?
Yeah, we know now that exercise is a dose. You do no exercise, that's not the right dose of that medicine. Mm-hmm. And we've also found out doing too much has some downside. Of course, you could injure yourself, injure your joints, but really long distance running, marathoning, triathlon, that is actually showing some deterioration in your health. So it looks like a relatively modest amount, 30 to 40 minutes a walk. And the longest lived people in the world, if you're 105 years old and you're living in Okinawa, Japan, you don't have machines, you don't have a gym, you walk. And walking 30 to 40 minutes a day is the basis of not injuring yourself, yet getting good flexibility and all. So that's all you need to do to kind of satisfy the plan. I want to live a long, healthy life. You can do more, no problem.
Yeah, no, I tell you, I've asked many different doctors and various healthcare professionals, what exercise is the best? Say, well, start off with walking, or pick any exercise that you like to do. Right. Then you'll do it, right?
Yeah. And there's the only other tips. If you can walk outside in a garden, in a forest, in a natural area, your blood pressure will be lower, and there is a therapeutic aspect to that versus walking in a city or inside a building. The second is listening to joyful music that you enjoy. There's beyond just common sense. It's been shown it will bring your blood pressure down. It actually helps your arteries stay healthy. There is a very interesting reaction to listening to beautiful music, whatever you define that as. It's probably not Ted Nugent.
No, well, I'll tell you why in the American Senior Gazette newspaper I have a page of poems, and you hit a very sensitive note. How about that? Of music. Four-line poem. It says, music speaks what cannot be expressed, heals the heart and it gives it rest, and heals the heart and actually heals the soul because it touches the portion of your body that it means the most. And the way it really brings out the whole aspect of healing the soul is the fact that it connects with the brain cells that you really have had the joyful moments. You can actually relive some of those happy moments in life.
Yeah, no doubt. Yeah, it really does heal the heart. You're absolutely right.
Right, and what about actually on a more profound basis, music and treating strokes? I've found that I've heard that sometimes a stroke victim can many times not have as severe a stroke by use of music. Have you had any experience of that area?
Not specifically a stroke, but when I'm doing procedures on patients, catheterizations and stents, there's good data that stress goes down with music of their choice or joyful music. So whether it's the 1812 Overture or some Bach, or maybe they like Neil Diamond, they will need less morphine and they'll be a healthier patient for it.
Well, we want to keep people healthy and aging gracefully, and it's been a delight to have you on the show today, and hopefully many more in the future. And I cannot leave this segment at all without saying my favorite saying, which is, yesterday is history, tomorrow is a mystery, today is a gift, and that's why we call it the present. Please enjoy your present by living and looking a life with the bright side of aging.